let's welcome our local breast care nurses, Val, Monica, Sharon and Stacey.
Come on, girls. We're coming. Exercise for the day. Yeah. Hello, everyone. There's some wonderful familiar faces out here, so thank you for all coming. We're nurses, we're not used to this public speaking gig, so be kind. I'm Stacey, I'm one of the Mcgrath breast care nurses, and I'm just going to talk a little bit about the role of the breast care nurse and the importance of screening, if I can work the computer. So just quickly to a bit of a shout out to the organisation I work for and to Jane Mcgrath, who's the reason that the Mcgrath Foundation started in the first place. I'm sure everyone's really familiar with the story of Jane and her husband Glenn. And a few statistics. Breast cancer is the most common cancer in Australian women. 1 in 7 will develop breast cancer in their lifetime and 1 in 542 men. The 5-year survival rate now is getting better and better, and it stands at 92%. 79% of new cases of breast cancer are in women over the age of 50. Young women generally have poorer survival outcomes than the older women, and the risk of being diagnosed of breast cancer increases with age. I can't see this. The average age of the first diagnosis of breast cancer is women at 61. This is my last Mcgrath shout out, Val. We've now up to 223 breast care nurses in Australia, largely due to a wonderful foundation and the advocacy of all our wonderful patients. We've got 3 in Hobart, 1 in Launceston and 2 in the northwest now. The team down south is myself, Sharon, Val, Monica and Michaela, who couldn't join us. So, the definition of a breast care nurse. We're all registered nurses, specially trained to manage the care of people with breast cancer throughout the course of your treatment, right from diagnosis through to living well. We're the principal liaison between the individual and the specialists who coordinate their treatment, whether it's early or metastatic. Breast care nurses optimise the individual's health and wellbeing at various phases across the continuum of care, including diagnosis, treatment, rehabilitation, follow-up and palliative care. Breast care nurses' practice incorporates advanced knowledge and skills in supportive care by providing specialised and tailored information, education and psychological support. And trials have shown that the breast care nurse's role enhances the early recognition of support needs, decreases psychological distress and improves continuity of care and understanding of the disease and its treatment. A breast care nurse normally has a background of oncology, breast care or women's health, or in my case theatre, which I was in for about 20 years. What do? We provide support, education and information to people with breast cancer, their family and those who care for them. We provide high standards of treatment in breast care nursing. Breast care nurse practice incorporates advanced knowledge and skills in supportive care by providing specialised and tailored information, education and psychological support. And the best time to get in touch with us is as soon as possible after diagnosis. We can explain the process, the pathology, the plan of care, different treatment options and supports available, and what to expect. We're also pretty good at booking appointments, and that's really helpful in a system that is often incredibly difficult to navigate. And we offer support and discussion on information that the individual has received from the consultant, surgeon, medical oncologist, radiation oncologist, physiotherapist. There's a long list. The role of breast screen, I'm sure everyone's really aware, it's a national screening program that began in 1991. It aims to reduce illness and death from breast cancer using screening mammography for early detection of unsuspected breast cancer in women. Early detection provides an opportunity to early treatment, which can reduce illness and death. Breast Screen Tasmania provides a free screening mammogram every 2 years to women between the ages of 50 and 74 throughout Tasmania, and that's an invitation program, so everyone receives something in the mail, hopefully. But anyone who is over 40 is eligible to access the program. A typical day for me. Well, firstly, every day is different. I'm based in Breast Screen, and I'm the first point of contact for the women that come through Breast Screen and get a positive breast cancer diagnosis. I help coordinate care, firstly with GPs, then referrals to surgeons or the Royal. I supply information and discuss any concerns, attend appointments if that's needed, and visit hospitals, specialist rooms and the Icon Centre. The BCNA is a wonderful resource. We use it every day in our practice. The My Care kits, the My Journey, online support, and to stop people doctor Googling. Not that that's bad, it's just bad if it's the wrong sites. The Look Good, Feel Better programs, fantastic. We've got the Cancer Council, Dragons Abreast, you're amazing. Mummy's Wish and local support groups and other things that are available. I'm sure everyone has accessed the Cancer Council. I don't really think I need to talk too much about them. Thank you. I think that's enough from me. Thank you so much, Kristen. And one last thing, I'd encourage everyone to, we've got about a 60% uptake on the screening program in Tassie, which is the best throughout Australia. But if there's one take-home message for everyone, it's encourage women to access the screening program and do regular breast checks. Thank you.
Do I go there? Just a minute. You just click. Yeah. Yep. All right. There we go. All right. Hello. My name's Monica Werner. I'm part of the breast care nursing team based at the Royal Hobart Hospital, and within our team there's 4 of us. There's Sharon Kerry, who's a metastatic breast cancer nurse from Mcgrath Foundation. Michaela Isaac, who you've heard Stacey mention. She's a Tasmanian Health funded breast care nurse. Val Smith, also early breast care nurse funded by Tasmanian Health Service, and myself, funded by Mcgrath. Just out of interest, while we're talking about breast care nurses, with a little bit of history, the first breast care nurse funded by Tasmanian Health Service was in 2001. That was one nurse, and now we are where we are. Obviously, breast care nurses cost money. Tasmanian Health Service could only fund what they can fund, and Mcgrath have come and contributed so that everybody has access who has had a diagnosis of breast cancer can access care, and wherever they are or whoever they are. Next. Oops. No? There? No?
I told you we were nurses.
You can't be good at everything, girls.
So I would have
So
broken
if you
it.
go this way.
Oh, the side
yeah.
arrow.
Yeah.
There we go. Okay. I've got a few stats. Stacey has come with some, but it's true, 80% are above 50, which is why we start screening. We invite from 50, but we have access from 40 to be able to get to screening. Now, there are around 1,000 young Australian women, and that's young meaning under 50 years of age, are diagnosed each year. So that's either through breast screen when they've gone after the age of 40, or a self-detected lump. The 5-year survival rate, as a testament to the good work that's been going with breast screen, is now up to 92%. And in Tasmania, in 2020, I haven't got stats after 2020 yet, but there were 447 new cases of breast cancer in Tasmania, and that's Menzies stat. Now, the bottom statistic is in relation to not only a risk for breast cancer, but also consider it with our other conversations that we had in wellness after active treatment for breast cancer. So 226,000 women in Australia have cardiovascular disease. So women who are at the end of their active cancer treatment and wanting to get on with the rest of their lives, the message of staying physically active, keeping within a healthy weight range, all these sorts of things, we don't want to have further complications with cardiovascular problems. I'm going to hand you over to my friend Val, who's going to talk a little bit about what else we do.
Thanks, Mon. Nice to see so many people I know, so thank you all for coming and thanks for the invitation. Sorry. It's right at my eye level. It's because I'm so short. Thank you. One of the things we find at the beginning of treatment, and I'm sure many of you will agree, it's really complex and it's quite confusing. Many of you will have experienced the 15 appointments in a few weeks phenomenon, and that's a real challenge. So one of the things we try and do really hard is to coordinate as many of them to be in a sort of timely and smooth way. Not always possible, but we'll have a really red hot go at that. The last thing people need is to be coming backwards and forwards to the hospital more than is absolutely required. Most of you will have experienced just the array of people you'll come across being treated for your cancers, whatever stage and whatever type of treatment you had. The other thing is it's a completely new language, and us doctors are actually, the doctors we work with are fantastic, and they will try hard to talk to you in a way that's easy to understand and not too confounding, but we find we do quite a lot of interpreting afterwards for you. It's another reason if you go to an appointment, take someone with you, because you will only remember a certain amount of what you're told, especially early on, and the person who's with you can pick up the bits that you've missed and can provide a bit of interpretation too, so keep that in mind. And that really goes for as beginning of treatment all the way through and sort of for the years afterwards. One of the things that happens to many of you is your really well-meaning friends and relatives will say, well, I know so-and-so who had this treatment. Now, every single treatment it's part of a standardised sort of package of care, but it's different for every single cancer. So really important to remember, and as you go on through the years after your treatment, different things come about. And it's really important to remember that what happened to so-and-so's neighbour down the road 3 times removed is not necessarily what needs to happen for you. So again, if you have queries and you can't understand why something is happening at any given point in the sort of trajectory, let us know and we can help you find out. I think that's really important. So all of our treatments are individualised for you, and they're based on the best evidence that we have at the moment. And of course, evidence changes, so things will change as time goes on. Quite often, you end up having more tests early on. A lot of women find this, or through the treatment journey, you end up having more tests than anyone's mentioned, up front. Just be aware, don't panic. If you're not sure why, approach someone to find out, and we can help guide you through all of that extra test and all that extra running around, basically. It's really important, sort of all those tests help give us a really good big picture of what's going on. So it's important to have all of that information. In amongst all of that, we try to work out what supports you need. To some extent, we have to be guided by you, so please, tell us at any stage if you feel like there's something missing or you need some help with something, tell us. And I always say to engage with everything, even if you think someone is sending you to someone who isn't going to help you that much, give it a go, see how it pans out. It's really worth having a dabble at everything. And when Katie talks about exercise, I cannot agree more strongly. So important, and she's mentioned a couple of the practitioners down here, the exercise physiologists, and we have some excellent physios as well. Talk to some of us if you need a referral or you want some help choosing someone, or a bit of motivation to get there, because it's getting out the door, that's the hard bit. Once you're there, lots of people who don't think they exercise actually really enjoy it. So it's worth pursuing. But that goes for all of the programs that are around the place. I can't emphasise strongly enough how important peer support is. So our support group is sensational. Hands up to Rosemary over there, who's facilitated the support group for many years. The Dragons Abreast girls, such a good way to get into exercise, into a team, and have that support. Now, my understanding is you guys don't talk about cancer all the time, so that's really nice. And it's just good to know that there's people who know what you know, but also you get all this other stuff. So there's a whole variety of resources and opportunities out there to sort of take up. Life goes on. Again, it's complex, and you need to step out of the treatment zone and into real life zone again, and that can be challenging. And basically, going through cancer treatment's pretty rubbish. There's no getting around that fact. But it's important to do what you can to acknowledge the changes that have happened to your body and really to your life in that time, to start to manage the symptoms of whatever treatments you've had. So, you know, if you're struggling, let people know. We certainly try and preempt those things, but it's not always possible. Everyone has to deal with the fear of cancer coming back. That's one of the number one things we see. And it's normal. Why wouldn't you worry about that? So again, if you're struggling, you know, reach out to people. Really important to start thinking about getting back to normal life. Really, really important. If you've had a bit of a hibernation while you've been having treatment, think about getting back to connecting with your family and your friends more closely. Think about joining a support group or a walking group. So the Heart Foundation run walking groups, because like Mon said, we think reducing your cardiovascular risk reduces lots of cancer risks too. What was I going to say? You'll all have your own experience of what is useful for you, and you'll all had your own really individual cancer experience, but it's really worthwhile trying to get something positive out of it, and that might be joining the Dragons Abreast. It might be learning to meditate. Yep. It might be learning, you know, meditation skills which will help you through the rest of your life. There's a whole series of things that could be positive out of this whole experience. So, thanks. And I'll hand over to Sharon.
Okay, I might put the microphone up. Sorry, Val. Val and I have worked together for, 13 years, 14 years. And yes, so we're the short and the tall of it all. so thank you. Okay, my name's Sharon. I'm the Mcgrath metastatic breast cancer nurse. I cover the southern part of Tasmania. I've been in this particular role for the last year and a half, and
Sorry, it's just flicked.
oh, has it? Oh. So where was I? Sorry. No, you're right. So I've just been in this role for the last year and a half. I've had quite a bit of experience with both early and metastatic, and I suppose the role of metastatic in Tasmania was probably about 5 years ago, if that. It is a fairly new role across Australia. To my knowledge, there's about 50 metastatic breast cancer nurses in Australia. So I'm one of them, and we've just got one up north who's just started 3 weeks ago. So woohoo! And she's coming down to have some training with me in a couple of weeks. So I can't wait to show her. as you know, I did mention to the metastatic ladies earlier today that my role is both at the Royal Hobart Hospital, so public patients, and I cover also the private patients at ICON. So it is a fairly big role. There's quite a few patients. I won't give you the data of that one. I do know, but I'm not going to tell you. So my role is basically because metastatic patients do have significant needs, more so than the early breast patients. And that has been noticed more so since I commenced this job a year and a half ago. So with their needs, because their treatments are long going, you have a patient for the rest of their life. And with modern treatments these days, I'm glad to say people are living longer and longer on these treatments, and it's fantastic. And that's why my list is getting higher and higher and higher. I don't mind, it's good. So I'm a very positive person, but I'm out there to advocate for the metastatic ladies because their challenges are huge, especially with the emotional and the physical side of things. So, you know, resource-wise is very similar. The BCNA, the difference is the Hope and Hurdles package is excellent for those with metastatic breast cancer. Unlike the My Journey kit is for the earlies, we have one for the metastatic ladies, and it has some great comprehensive information in those packs. So for those of you who haven't got that, please come and see the BCNA ladies or myself. It's really valuable. So Cancer Council's fantastic as well. And today I've been chatting with the Cancer Council and we're organising a secondary support group. So yes, long time coming. And I do understand after a few conversations with some patients over the last week that they would prefer an informal, safe environment, and so the Cancer Council have offered to take that on. So if there's anybody in the room that I've missed today and they haven't put a form in, come and see me please afterwards, and I'll get a form in so they can contact you when they're ready to start with my help as well. And I'll just be there as the odd guest speaker, so it won't be so clinical. And that's what we've found that the women want, not such a clinical environment. But I'll make a guest appearance sometimes, if that's all right. So for me, for the women with metastatic breast cancer, it's all about quality of life and making the most the quality that you have in your life. And small steps. The treatments can be fairly harsh, but these days, as the girls have said, with exercise and diet and psychology and dietitians, we can make it a lot easier for people than it would be. So I just think the information out there is huge, and I can't go through it all today, but palliative care, a lot of people freak out when they hear the word palliative care. Please don't, because that organisation here in Tasmania, they're fabulous and they have the right resources for you from the start, and we really suggest that people get in touch with palliative care early. And so, yeah, but anyway, that's all from me. I just thought I'd do a quick introduction, and you guys, there's some business cards out the front for all of us. So just help yourself to a card today if you would like to contact us for any further information. Thank you, and thanks BCNA for having us. We really appreciate it.
Thank you so much. I think we can do a much bigger round of applause though, don't you?